Hello, teacher. This is Pablo Hipolito Guzman, and now we'll continue with the part 3 of the exercise from the book. And now I will start with the theory, the third part called Part of the Body 2. The part A said the abdomen. The main organs of the body have ordinary English name and doctors use these words, but when an adjective is needed, they often use an anatomical word. For example, we can say disease or of the liver, of or hepatic disease. Some anatomical organs, for example, the pancreas, have no ordinary names. For example, we have pancreas, duoden, gallbladder, liver, right kidneys and left kidneys, and spleen, and also stomach. When doctors talk about the main part of the digestive system, they use the word bowel or intestine. The small intestine of or the small bowel, the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passages. The part B, chest. The chest or thorax contains the organs of respiration and the heart. The main part of the respiratory system are the airways and the lungs. The left lung is divided into two lobes and the right into three. The airways consist of the larynx, the trachea, or with people. The right and the left bronchus and the bronchioles. The chest is separated from the abdomen by the diaphragm. C. The pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is the situator into the pelvis, and it is connected to each kidney via a long tube called the ureter. One of each side, the ureter carries the urine from the kidneys to the bladder, where it is stored until you decide to empty your bladder. When that's happened, the urine passes down another tube called the urethra to the outside. Okay, now we will continue with the exercise. The first one that we have is level the diaphragm using words from the box. Look at B opposite to help you. Okay. The one is windpipe, the two is airways, the three is lung, the four is diaphragm, the five is lobes, the six is heart, and the seven is bronchioles. The exercise number 3 said match the conditions 1 and 8 with the organ affected using your medical knowledge. Hepatitis, F liver, pneumonia, lung, nephritis, kidneys, gastric ulcer, stomach, cystitis, bladder, angina pectoris, health, cholecystitis, gallbladder, and ulcerative colitis, large bowel. The part number 3 said, complete the textbook extra. Look at A and C opposite to help you. To examine a patient for enlarged abdominal organs, first feel for the liver and the gallbladder on the right side. Don't think, ask the patient to take a deep breath with pressing with the fingers upwards and inwards. Next, feel for the right kidneys and then cross over the other side for left kidneys. Still, Still on the left side, palpate for a enlarged spleen. Finally, moving to the lower abdomen and feel for the bladder, which is only feel if it is full. Thank you so much, teacher, for see that video. There are a lot of words that are so confusing for me because I try to practice more, but when I start to recording the video, I forget a little the correct pronunciation. Sorry for that. I will try to keep improving my medical words. To be better. Sorry for that, but I will try to get better. Thank you.